Good morning, everyone, and thank you for having me here. I don't know how many of you all are running a disability board at your places, but if you are, then you know that this is a common problem, and especially so when you become from a disability board to one of the verification centers for NEET exam. So, as we all know that there are a certain percentage of seats kept aside for PWD quota, which is persons with disabilities, persons with benchmark disabilities. It's PWBD as it is called. And there are 16 centers in India wherein this has to be verified. So what happens is the child who is going to appear for NEET, the eligible candidates, they'll first go to a government hospital, a disability board, and get their UDID certificate, which makes them eligible to appear in the NEET under the PWD quota. But once the results are declared, they must come to one of the 16 verified centers and recheck their percentage of disability. And if it is shown to be 40% or more, they can be classified or they can be considered as under the PWD quota, provided that with the use of low vision aids, that 40 to 80% disability is brought to under 40%. So the criteria is for PWD 40 to 80% for visual disability, and after that you get it down below 40, anything below 40 to be eligible to pursue MBBS. So that was the principle. And what we wanted to know is this is the definition of PWD, and benchmark disability is 40 to 80%. As I said, 40% is the cutoff, the benchmark. This is the chart that is followed for the UDID. You all must be all following this. For the percentage disability, you can follow both the visual acuity as well as the fields. So visual fields is also one of the criteria. So what we did, we were seeing a lot of students who came as UDID 40% and above in benchmark, and we saw that many of them didn't verify in our center. So there was a huge gap between the UDID, the percentage brought by the students for UDID, which is 40% and above, and the ones we gave them finally, the percentage we gave them, and many of them didn't turn to be eligible. So we wanted to know the difference between the primary center and our center, which is a tertiary center, and the ratio of students who were wanting to be eligible, so those who applied as to who actually became eligible. So that is what we wanted to see, and in the light of malingering, and what are the causes and how to catch it at the primary center level itself. So it was a retrospective study. We took it from our records from the past 4 years since we've been the verification center. We had complete data for 154 students, and it was consecutive sampling. So all students who were eligible for NEET and who had their result in their hand and who had got their 40% UDID certificate. Those who were excluded were those who didn't have a certificate or a result in their hand. We had it in the Department of Ophthalmology, and the data was collected. So they presented to the Ophthal department, the data was retrieved and categorized. Can you believe it? What are the stakes? The stakes are that the average rank of these students was around 5 lakhs. Anything from 11 lakhs to around 1 lakh we found. The All India AIR rank was, the average was 5 lakhs, and the average it came down to after applying PWD was 1300. Now do you know why I'm presenting this? So the stakes are very high. So if we had gone according to what the UDID they got, everyone would have got eligible. So except for 3 who were under 40%, all remaining were eligible according to the existing UDID certificate for PWD quota. But actually only 44 or 27% were eligible. Only 27% of everyone who came. So amongst the UDID, only three patients, students had 40%, less than 40%. Everyone had either 40 or more than 40%, the blue bars. And in our case, just see, it's a reversal. The oranges were what we verified. 110 out of 154 students were not crossing the benchmark, So this is, if you see that in the agreement, let's say how many times did we agree with the primary center? So in the less than 40, there were just 3 students. So we agreed 66% of the times, and only 1 was eligible. Actually, they underestimated the eligibility. So one of them, who was 30, actually turned out to be 40. And amongst those, it'll take some time, ma'am, a little more time if it's okay. So amongst those above 40%, we agreed with only 3, and for 25 students, it was less than what was given, and for just 1, it was more. So these were the number who were eligible and not eligible. For those equal to 40, a huge percent, which is, you can see 91 out of 122 turned out to be less than what they came as. So most of them were ineligible. So if you see it percentage-wise, I'll show you that amongst the 122 students who came as equal to 40%, 91 were less. You know what? Out of those 91, 27 were one-eyed. So there's a very high chance that the 30% is made 40%. Very high chance. 30% is made 40%. So 44% of them were just given a 10% higher weightage. And in the above 40% also, we didn't agree with a huge percentage, which is 25 out of 29. And even amongst these, the highest was in the 30% category. So the 30% were the ones where they were given a higher percent. So this was a summary that amongst the 154 students, we agreed only in 27% of the diagnosis, and in 11 we actually gave higher scores, but in 75% the percentage was less than that given in primary. You know how much less? The average, it was 23% less. 23% less. You know what was shocking? What surprised us was that 30% of those who came for PWD quota had 0% disability. 0%. And amongst the others, 84% of the students had exaggerated scores, out of which 30% was 0% disability, so they were like fully exaggerated from 0 to 40, and the others were somewhat exaggerated, like some were one-eyed. Like I said, 30% were one-eyed, and the others were somewhere in between, like they had 10% or 20%, and they were given as 40 or more. So why is this happening in a primary center? Maybe the lack of index of suspicion, that this has to be suspicious, or lack of sophisticated equipment to rule out malingering, non-availability of visual fields, because that's also a criteria, inadequate training of the local doctors there, confusion with the criteria, because some parts of the criteria are not very well defined, and can it be, sympathetic with the student ki chalo 30 ka 40 de dete hain, kya hai, zindagi ban jayegi. So, and why is this trend happening? Because you saw how huge a rank difference there can be, the difference in asking percentage, the Indian stress of bacha doctor ya engineer ban jayega. And so what we can do and what we did, how did we get this percentage finally? So first of all, we took the parents out of the room. We took the guards inside. Because there were a lot of fights and people were threatening us and things like that. And then what we did was repeat vision following counseling. Students ko bitha ke counseling. Then randomization on the Snellens, logmar charts where they could not guess that this could be 6 by 24 or this could be 6 by 18. And words 4 dot test, and of course next stage was visual fields, and we also resorted to VEP. One thing that we have to warn ourselves against is amblyopia, because amblyopia, there was a 28% incidence amongst primary centers, and for us it was only 16%. We're very clear about the definition of amblyopia. So in conclusion, 30% of all students had no disability at all. 25% of the total were one-eyed and were actually not eligible for the benchmark disability. 95% amongst these had an exaggerated score and were eligible as per the primary center. Now, among 70%, this is amongst the 70% with disability, they had an exaggerated score. Now, 84 of the total had exaggerated scores, and only 28% or 29% were actually eligible for the PWD quota. So what we can bring it down to is awareness, education of the primary care ophthalmologist, fine-tuning of the criteria, beware of the diagnosis of amblyopia, high index of suspicion, use of certain modalities, and parents outside, guard inside. Thank you.
Thank you very much. I mean, this is something new for me, but we'll take the questions in the end if there are any. Thank you.